doctors are seeing more and more patients suffering serious injuries such as chemical burns and infections due to, get this, eyelash extensions. The findings from a consumer group are alarming considering the popularity of fake eyelashes. Here to talk more about this is optometrist Dr. Panzer. Good morning to you.
Thank you. Thank you.
Well, this doesn't sound too good because anytime you're dealing with the eye and you've got an infection, it's something that needs to be treated.
Well, you have to remember that all those salons have to practice good hygiene, and we know that they're not necessarily all going to have sterilized instruments and things to apply these. And the glue that they use has a formaldehyde base, which if you were to think about putting it on your lashes, you wouldn't be all too crazy about that. And then there's the hygiene issue, which is that for 48 hours after they're put on, you're not supposed to wash them at all. And as eye doctors, we're very concerned these days about people's eyelid hygiene, which leads to dry eye. So those are some of the problems. Many of the people will get infections. Again, you have typical eyelid infections, plugged glands and things of that nature without the assistance of glue.
Mm-hmm. And when we talk about infections, you mentioned the hygiene in the salon. Is that mostly what it's caused from versus anything that's happening in the company's home?
I would think it was more along the lines of the hygiene that the person was able to perform after the fact. After they had the lashes put on, that they weren't able to clean their own lids as much, that they say not to wash your face for 2 days after you have them professionally put on, that just generally the damage that they might happen to do to your own lashes, that your own lashes will possibly fall out.
And then what kind of infection are we talking about anyway?
Staph and strep typically are the infections that are most prevalent. They're apparent everywhere in your body. It's just a question of whether you're able to clean that part of your body.
Right. Let's talk about what now. I'm interested in more about what you said with dry eye and cleaning your lids. What's the deal with that?
Well, the most common premise about dry eye is that you have meibomian glands, which are the glands just below the lashes, which are plugged up. Well, the way you unplug them, if you will, is with heat and with friction and rubbing them, and that opens up the meibomian gland. Well, how are you going to do that if you have this very tender substance on your eyelid that you don't want to rub? So therefore the meibomian glands are going to become plugged and you're going to develop styes.
And then what do you do? I guess that's
then you wind up with the eye doctor who takes all your lashes off and then removes the stye.
Okay, so you have some alternative ideas for somebody who wants to have long lashes?
So there are products, I'm sure that all the listeners are familiar with Latisse, which is a glaucoma drug which was discovered to grow lashes. It doesn't truly grow lashes. What it truly does is keep the lashes from falling out. So lashes have, say, a 4 to 6 weeks lifespan, and if you extend that lifespan a little longer, they grow a little longer. There are over-the-counter products other than Latisse, which have a peptide in them, which also seems to keep the lash in place longer, so it seems to grow longer. It won't be quite as dramatic as mink fake eyelashes, but it is an option.
And then these are some of the things that you can just get over the counter?
Yes. Well, what I wanted to talk about was that many eye doctors, myself included, use a good many eyelid preparations to clean eyelids on a daily basis, and if you can't do that, you're more prone to infections.
So you need to clean them.
Yes.
What's the proper way to do it if you're at home?
Well, the proper way to clean it is simply with soap and water, and antibacterial soap if you're not purchasing any specialized product.
Most people don't want soap anywhere around their eyes, though.
They would be seriously mistaken. There are plenty of bacteria on your eyelids, and those cause continued eye infections, styes, things of that nature. And so you don't really want to keep from washing your eyes. Now, you're not washing the inside of your eye, of course, you're washing the outside.
Of course. All right. Makeup remover, that's okay too?
Makeup remover is fine.
All right. All right. Thank you, Dr. Panzer, for being here and breaking it all down. Now we know what to expect for anyone who wears those lashes.
Thank you for having me.
Right now,